I know this is just a brutally difficult time for those personal services businesses. Many of them are small owner-operator businesses where it's often the only source of income in that household, and everything is tied up in those small businesses. And I also acknowledge that so many of those businesses, hairdressers and estheticians and so many others have non-therapeutic massage, for example, they have taken great precaution to operate safely throughout COVID. Now, having said that, I want to take us back to where we were about 5 weeks ago, when we were in the midst of what was, quite frankly, a frightening exponential growth in COVID in Alberta that was causing enormous stress on our healthcare system. And if we had not taken firm measures in November, December, it's clear to me that we would not have just had 950 people with COVID in hospital and approaching 200 in ICUs, but that could have doubled and doubled again, which would have completely overwhelmed the healthcare system. As I've said, our government's approach has been to use restrictions as a last and limited measure because we do recognize the damaging impact that they have. Now, I do understand that people see any restriction as being arbitrary. I mean, everybody wants, it seems quite obviously and quite rationally, they want their area of activity, of economic or social activity to open up. But we had to look at, basically what we had to do was just reduce overall social contact. And we will be looking at the data once the numbers stabilize from the dip in testing over the Christmas holidays. And in a couple of weeks, we'll be coming back to look at that. And my heart truly goes out to those folks in the personal services businesses. In terms of what exactly has driven the policy with respect to their restrictions, I'll defer to Dr. Hinshaw.
Thank you, Premier. I would echo what the Premier has said in terms of recognizing that the restrictions in place are a significant burden to many, and also the point that the operators of those businesses and people who work in those businesses worked very hard over the summer and fall to make those safe places. So when we were able to follow up with all of our cases, we didn't see significant transmission happening in the context of relatively low community transmission. But there are two things that we don't know from the period of time in November and December when we had very, very high cases. First of all, given the extremely rapid growth of cases, we were not able to follow up with many people in November and December, so we simply don't know where they acquired the infection. And the second thing we don't know is whether or not the precautions that seemed to be effective, again, in the earlier months, with the significant spike in community transmission, whether that would have put enough pressure onto those businesses where they would have seen transmission. And right now, we know, for example, you'd mentioned gyms in your list, and I would say that we do know that group activity and group fitness has been a source of transmission. We have seen transmission in some gyms. I know that the fitness industry has, again, gone to great lengths to make their businesses safe. And as we continue to look at the data, we will hopefully be able to look at potentially easing measures, but the best way to be able to open these businesses again is for all of us to work together to bring our numbers down.
I'll just add one more comment on this, which is, despite all of this, Alberta continues in almost every area to have the least stringent restrictions in the country. So I think that reflects our effort to find a balance here. We have other provinces bringing in curfews now that have shut down virtually all retail businesses, far larger portions of their economies. We've tried to be targeted in our approach, given the critical situation in November and December.